coverings of the kidney. So what are the coverings of the kidney? So kidney from inside to outside are covered with 4 coverings. From inside to outside. From inside to outside. Look at this figure. This one is the renal capsule or fibrous capsule. Fibrous capsule. Next to it is this one. This is renal fat. This green color, this is the renal fascia. And this last one is pararenal body. So there are 4 coverings of the kidney. First is the pararenal body. Second, from outside to inside, pararenal body, then renal fascia, then perirenal fat, then renal capsule or fibrous capsule. Okay, these are 4 coverings of the kidney. First, fibrous capsule. What is fibrous capsule? This is the thin membrane which invests the body of the kidney, and it's lying the renal sinuses, the space of the kidney. Okay, most interiorly. Then pararenal fat. It is a layer of adipose tissue. This is the layer of adipose tissue. You see this in this picture. This is the fatty cells which called adipose tissue. Okay, these are the adipose tissue which is lying outside the membrane. This adipose tissue is thickest at the borders of the kidney. Okay, medial border and lateral border. This second covering, perirenal fat, is thickest at the lateral border and the medial border. Now comes to the renal fascia. It's little bit complicated to understand the renal fascia. Okay, so first of all we have to draw something. Look, this is a superior surface of the kidney. Okay, superior surface of the kidney. Oh, now the renal fascia. So this is the kidney, this is the central vertebra, and these are the 2 muscles, psoas major and quadratus lumborum. So renal fascia, according to the modern definition of renal fascia, it is a bilaminated structure which has 2 layers. Bilaminated structure. One is anteriorly and the other is posteriorly. Okay, it arrives, one is anteriorly, other is posteriorly. Okay, now the posterior layer is blended with the fascia of these 2 muscles. This blended with posterior layer and thickens, but the anterior layer remains thin because it doesn't blend with anyone and it remains alone. Simple. These 2 layers on the lateral side of the kidney merge to form lateral cornel ligament. On the medial side, these 2 layers continues, anterior layer, and at the pelvis region, this layer blends with the ureter, deep fascia of the ureter. They blend with the fascia of the ureter and form pelvic uretic or parauretic fat or parauretic fat. This is very important. Superiorly, both layers continue separately, and the anterior layer fused with the right coronary ligament of the liver. Right coronary ligament of the liver, and on the right side, right kidney, the anterior layer fuses with the right. There is a liver. It has right coronary ligament. This layer fused with the right coronary ligament, while the posterior layer moves above the liver, and there is diaphragm is present, and this posterior layer fused with the diaphragm. So both layers separately fused with the other structures. Anterior layer with the right coronary ligament and posterior layer with the diaphragm. Okay. On the suprarenal gland, these layers remain separate and they form a septum, which separate the suprarenal gland from the kidney, like this. Here is the suprarenal gland is present, here is the kidney. So there is septum formation by these posterior anterior layer of the renal fascia and separate the suprarenal gland from the kidney. On the inferior side, it's remain normally. Okay, this is the relationship of the right kidney. Left kidney has similar relations. Okay, the renal fascia of left kidney is same, except one difference, that the anterior layer, because there is no layer superior to it, so there is a gastrophrenic ligament. What is gastrophrenic ligament? This ligament connects the stomach with the diaphragm. So the anterior layer fused with this ligament, and the posterior layer same as in the on the right side, it fuses with the diaphragm. So this is the formation. This is how the renal fascia covering the kidney. This is how the renal fascia covering the kidney. Now after the renal fascia, we have the last covering, which is pararenal body. It provides cushioning to the kidney, and it also fills the space present between the vertebra or the kidney, which is called paravertebral gutter. So this is all about the coverings of the kidney.